Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. Kewanee Hospital, a critical access hospital in small Illinois community, made a commitment to go digital and implement an electronic health record. In 2011, they were recognized among H&HN's most wired small and rural hospitals. Today, I'm joined by Lynn Fulton, COO of Kewanee Hospital, to discuss moving a rural hospital into the information age, going paperless. Welcome, Lynn. Thanks for joining me today. So, where did you start with this whole effort?
We really started back in 1999 when we purchased our current IT system. The nurses started documenting in the chart using the computer at that point in time, and then ever since then we've just been adding to it as we went along.
And what kind of involvement did you have from the board and from the executive team in terms of commitment to IT and everything that went into moving to an electronic health record?
Well, in 2004, when President Bush was in office, he sent forth an executive order to have an interoperable healthcare record by 2014. Our CEO kind of wanted to capitalize on that and said, we're planning for a new building. This is really when we need to concentrate on getting our EHR put together. And so our board of trustees did a board resolution in 2006 that said Kewanee Hospital was going to start putting the path to have a fully electronic healthcare record. And really we have moved on steadily since that point in time to where we are today, where we have no paper on any of our patient charts.
What kind of resources financially did this take for a hospital of your size?
We did it over time, which makes it much more manageable. I know hospitals today that are trying to put in electronic healthcare records to meet the meaningful use requirements are having to put forth a lot of money all at once. We started ours back in 1999, so we were able to put pieces in at a time. But in any given year, usually IT takes up to 30 to 40% of our overall capital budget. And for us, our capital budget usually runs in the neighborhood of about $2 million. So every year we're putting that back into our system.
And what are some of the infrastructure improvements that you're finding as you're moving along this path that you still need to keep adding?
It's really constant. One of the big pieces that we have to do every year is budget for interfaces. Because even though we have basically an enterprise-wide system, you still have other pieces that can be interfaced right into the electronic healthcare record so that your nursing staff isn't having to duplicate efforts. And then also your backbone. All that IT has to run on something. And so you have to make sure that your network is current and that it can support, because you don't want downtime. Nobody's going to have faith in a system that goes down because they can't stay connected. Just this past year, we had to upgrade all of our wireless ports. Because as we're getting new laptops and new tablets, they're pulling more from those wireless ports. And when you have a physician that enters in their note on the computer and loses it, they get very upset naturally. And so we had to make sure that we had that system to where it needed to be.
Where are you in the meaningful use attestation?
We successfully attested in the first year in 2011. That was a goal.
Congratulations.
Thank you. Yes, we were very excited. As soon as the government put forth the expectations, we said we can do this. We're already well on our way. There's no reason that we can't do that successfully. And we did.
And what was the most challenging out of all of it?
There were a lot of challenges. Interestingly enough, the least challenging was the CPOE, the physician order entry. We already had that down, and we sailed right through that one. Really, some of the difficulties was the quality reporting piece. We had to put in that component into our system and getting that to where it worked so that it would have the correct data. That took a little bit of time. And then staying on top of all the measures, because you have to make sure that you're meeting all of them for 90 days. And so we actually were tracking it for months to make sure that we were consistently meeting it.
And what about CPOE when you brought that on board? What were the challenges there and how did you deal with it?
Really clinician adoption. I jokingly say, we went live with CPOE in 2006, only we really didn't go live because nobody used it. We purchased it, we put it out there, and nobody used the system. We really had to mandate it, and we did that later in 2007 with the backing of our board. And we told our clinicians that they had to use our electronic healthcare record. This is where the future is, and if you're going to practice in our hospital, you're going to have to use our record. But we didn't do that without giving them a lot of resources. We worked with them, we listened, we tried to make that system the best it could be for them. We brought in our vendor repeatedly to do training and education, and really gave them confidence in using the record so that they would know that it was really the best option for their patients.
Did you use other clinicians to help them?
We did. We had a physician champion, which always helps, and he did take the time to know the system and know it well. But really, our nursing staff was the key. I can't give them enough credit. They did a phenomenal job. We have a number of super users in our nursing areas that know the physician system as well as they know their piece of it, and they sit side by side. Anytime we have a change, anytime extra education, or we bring a new physician into the hospital, they're right beside them, helping them every bit of the way.
What improvements in quality and operations have you seen from all this IT implementation that you've undertaken?
There's really several. The access to information, I think, is one of the biggest pieces. Somebody asked me earlier today, what was the biggest thing, and how do you measure value? And an example I gave is in our family health clinic. Today, we can pull all of our patients that are over the age of 40 and in need of a mammogram, and we can send them a reminder, we can call them, and we can have that information real time. Where before, with a paper chart, that would be hours or years worth of time of going through those charts. If we want to do education on diabetes, we're able to pull that out of our patient record and see who are patients that have diabetes, so we can make sure that they're able to attend that education. And so we use our IT information all the time, and it makes it a better place for our patients.
Thank you for joining us today.
Thank you.